Heart attacks don't start in the heart. Strokes don't start in the brain. They start silently in your blood vessels. And the scary part, some of your daily habits may be damaging the blood vessels right now without any symptoms and without you knowing it. Hi, I'm Dr. Vikash Chennur, an interventional radiologist. I treat blocked arteries, varicose veins, and many other vascular problems from inside the body. And what I see again and again is this: most of these problems are not sudden, and they're as a result of years of small daily habits. In this video, I will talk about the most common habits that slowly destroy your vascular health and what you can do to prevent it from happening. Make sure you stay till the end, because one of these habits is something almost everyone does daily. Let's start with one of the biggest culprits: prolonged sitting. If you sit for 6 to 8 hours a day, your blood flow slows down, especially in the legs. This increases the risk of varicose veins, blood clots, poor circulation. Your vessels are designed for movement. Even if you exercise for 1 hour in a day but sit throughout the rest of the day, the damage still adds up. How do we fix this? Stand or walk every 45 to 60 minutes once. Simple leg movements improve circulation immediately. Next one, smoking, even occasional smoking. This one is obvious but is often underestimated. Smoking just doesn't affect your lungs, it directly damages the inner lining of the blood vessels called the endothelium. This leads to narrowing of the arteries, increased clot formation, faster plaque buildup. Even occasional smoking is harmful because vascular damage is cumulative and not occasional. Now, moving on to the next habit, ignoring high blood pressure. High blood pressure is called silent killer for a reason. You may feel completely fine while your vessels are under constant stress when there is high blood pressure. Over time, this leads to stiff arteries, increased risk of stroke, damage to small vessels in brain, kidneys, eyes. The problem? Most people do not check it regularly. And the fix would be to check blood pressure periodically and maintain it in an acceptable range. Do not ignore borderline readings. Moving on to the next habit, consuming food with high sugar and processed foods. What you eat directly affects your vessels. A diet which is high in sugar, unhealthy fats, processed foods leads to inflammation inside the blood vessels. This accelerates plaque formation and narrowing of arteries, and eventually heart disease, stroke, peripheral arterial disease. This damage happens silently over years. Now, the next habit, the most important one I would think, is lack of sleep. This one surprises many people. Poor sleep affects your vascular health. It disrupts blood pressure regulation, hormone balance, inflammation control. And chronic sleep deprivation increases the risk of hypertension, vascular disease, metabolic disease. Sleep is not just rest, it's repair time for your body. The next habit, ignoring early symptoms. Many vascular conditions give early warning signs, but people ignore them. For example, leg pain while walking, visible veins on the legs, swelling, numbness, frequent cramps. By the time they seek help, the disease is already advanced. Early evaluation can prevent major complications and make treatments easier. Moving on to the next one, lack of regular movement or exercise. Blood vessels need movement to stay healthy. Exercise helps improve circulation and maintain vessel flexibility. It also reduces the risk of blockages. You don't need extreme workouts. Even brisk walking Cycling, simple daily activity, helps a lot. They can significantly improve the vascular health. So, if you look at this, most vascular diseases are not sudden events, they are a result of daily habits repeated over years. The good news, that means they are also preventable. If you found this helpful, I regularly create content on minimally invasive treatments, alternatives to surgery, and how to protect your health early. Subscribe to the channel for more such medical insights and share this with someone who sits long hours or ignores their health, because prevention is always easier than treatment. I'm Dr. Vikash Chennur, and I'll see you in the next video. Take care and stay healthy until then.